Now, there are many prostaglandins in the body that do different jobs, but looking at the main ones here. Starting with prostaglandin E2. It works in the GI to increase mucus secretion, increase the amount of HCO3 we produce and water, and reduce the acidity. All this is to protect your gastric lining. That is why NSAID use leads to gastric ulcers. For the cardiovascular and renal system, it acts as a vasodilator and reduces the release of ADH. Other things is involved in fever, hyperalgesia, and uterine contractions. Stuff is prostaglandin F2A, which effects leads to potent uterine contraction, bronchoconstriction, and reduce intraocular pressure. For prostaglandin I2, its effects are vasodilation, hyperalgesia, and inhibits platelet aggregation. And last but not least is thromboxane A2. It is a vasoconstrictor and promotes platelet aggregation and bronchoconstriction. And these beautiful endogenous chemicals are great, but they have a clinical challenge. They lack organ selectivity and have extremely short half lives due to their very, very efficient metabolism. So, there comes synthetics, which enforce stability and targeted application. So, you can pause the video and look through the analogs of each of these prostaglandins and see how they function clinically. Okay, so liposuccinase now is angry because we've made it a child that nobody paid attention to. So let's quickly go back to liposuccinase. So liposuccinase converts arachidonic acid into leukotrienes. And the way it does that is by first converting arachidonic acid to 5-HPET, which is an intermediate, which they converted into leukotriene A4. Then from A4, you get your other leukotrienes. So one of the leukotrienes you get from leukotriene A4 is leukotriene B4, which is a potent inflammatory agent and causes neutrophil chemotaxis. And the other ones are the cysternal leukotrienes, leukotriene C4, leukotriene D4, leukotriene E4. All these are potent bronchoconstrictors. So there are two ways you can inhibit leukotrienes. One way is by using the drug xylotine, which will directly inhibit lipooxygenase and prevent the production of leukotrienes in the first place. The other way is by using competitive antagonists at the cysternal leukotriene target receptors in the lungs. Drugs like the Lucas do this job very, very well.